welcome to Ask Dr. Geier Live, wherever you're watching. Hope you're making today your masterpiece. I am Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. It is that one time each month, the one place each month that I answer your orthopedic injury questions and your regenerative medicine questions. I don't do it really anywhere else, in blog comments, in comments to YouTube videos, or anywhere else, emails, anything like that. I can't legally give medical advice online. This is meant for information and educational purposes only, but because I get hundreds and hundreds and hundreds of questions left in the comments to my videos, I try to do at least once a month where I try to answer your questions in a live format. Now, I do answer a lot of questions. I basically see the questions and repackage them as new YouTube videos. That's how I'm able to record that many. But this is the one place and one time I do it live where you can ask the questions. Let me actually turn on the questions and comments. Mossy87, if I can get this to work, says hello. There we are. Also, if you're watching on X, sometimes the questions come through, sometimes they don't. If your question is, if you're not seeing it answered, go over to YouTube, my YouTube channel, at Dr. David Geier, DrDavidGeier, ask it there. If you're on YouTube, I see this every time. Leave your question in the chat. I cannot see the comments. If you leave it there, I will not see it, and I promise you that it just won't get answered. And it's not that I'm ignoring you, those just don't come through. I use a software that sends this out to multiple platforms. I'm not directly on YouTube, so I cannot see the comments. Leave those in the chat. All right, one of the things, Noob says, hi all. Yes, very excited to have you. There was one question that came in last month right as I was sort of signing off, and I didn't see it in the chat. I saw it as soon as I ended the live stream. I'm going to ask that. I apologize. I don't remember the name of the person that asked it, but he asked, how many years of postgraduate education is sports medicine? It depends. There's orthopedic sports medicine, what I did, orthopedic surgery to sports medicine, and then you're doing the surgeries in addition to taking care of the teams and things like that. And then there's primary care sports medicine, at least the way it works in the United States. Orthopedic surgery, orthopedic sports medicine is 4 years of medical school, a year of internship, and then 4 years of orthopedic surgery residency, and a year of orthopedic sports medicine fellowship. So all in all, that is 10 years after college before you can start practicing as an orthopedic sports medicine specialist. Primary care sports medicine depends a little bit on what the residency you do first. It would still be the 4 years of medical school, and then either 3 or 4 years depending on if it's pediatrics or emergency medicine or family medicine or internal medicine or PM&R, physical medicine and rehabilitation. So it depends on that residency, and then usually a year of primary care sports medicine fellowship, and then you go out and practice. Now you're not doing the surgeries, but you're still doing a lot, sometimes team doctors, a lot of the orthopedic coverage, trying to determine the injuries and then maybe sending it to the orthopedic surgeon if it needs surgery. But you're also doing a lot of the medical conditions that athletes have, heart and concussions and things like that. It's really great too. Just depends on your personality. So I apologize for missing that last time. I just wanted to get that out there. All right, Desmond says, and I'm a big Memphis Grizzly fan, and one of our best players is named Desmond, so I'm a big fan. Desmond Omar, hey doc, I have a question. A few years back, I was a parkour player, ended up hurt, broke my ankle in my left leg. Any way I healed from that? I'm not 100% sure what the question is there. Clarify that in a sentence, and I'll try to better answer it. Otherwise, I'll just talk about ankle fractures and healing of that generally. All right, Noob says, are peptide vial blends TB500 BPC okay to use, or should they be used from two separate vials? There is debate about that. That's actually a good question, and most compounding pharmacies will send you two separate vials of the thymosin beta 4 and the BPC 157. There is debate, and I have seen a peptide expert when I did my peptide therapy certification that debated just even if you got 2 separate vials of peptides, if you drew them up in one syringe together, and he argued that we don't know if that does something to mess up the peptides or not. To me, I'm skeptical of that. Seems like it wouldn't be much different than just taking 2 different medications by pill, and those don't interact. So I don't think it would be if you just pulled them into the same syringe, but most compounding pharmacies give them to you together. I suppose there could be some that deliver them together in one vial. I'd be a little bit more skeptical of that because typically they're mixed in different ratios with water and things like that. So I'd have some questions, but again, I don't know the legitimacy of where that's coming from, or I've got some concerns. It's not to say that it couldn't be done. And I'm also not a pharmacist, so I don't know the specifics, but I probably would feel better personally if I was prescribing something like that, 2 separate vials, one of the thymosin beta-4 and one of the BPC 157. All right, here we go. Desmond, a few months after I've started, felt pain in my right knee. Doctor said I had chondromalacia, still hurt when I work out, makes cracking sound. Is there any way to permanently heal from that? Okay, now I got it. So had a ankle/leg injury, now is having what's called chondromalacia. Even though we've gotten away from that term, we use patellofemoral pain. Now that is pain underneath the kneecap. Sometimes it can be true chondromalacia where the cartilage starts to soften or even fissure and break down, which can progress to arthritis. But yes, you can get over that. I have personally had patellofemoral pain. I had it for years in my teenage years, and I know how uncomfortable it is. Trouble going up and down stairs, running hills, going down hills, things, sitting for long periods of time with your knee bent, really, really problematic. What I would have my patients do is a lot of work with a physical therapist and or doing home exercises, strengthening specific muscles around the knee and around the hip to unload pressure off of that kneecap. And it works very well, but it's not a quick fix. It's something that you have to do daily for months, sometimes 2-3 months before that typically gets better. But that typically, assuming that there's not something more going on in the knee, is typically enough to get that done. So great question. Liz says, left total knee replacement, idiopathic avascular necrosis. Yikes, or that's coming soon. How can I offset the short-term, long-term impact of surgery, meds, anesthesia, persistent post-concussion syndrome? I'm not 100% sure that I understand what that means. As far as long-term, short-term impact of surgery, if we're talking about the knee replacement, I would very strongly try to get into therapy and strengthen the muscles around the knee as fast as possible and get the range of motion back as fast as possible. Probably would do nerve block if possible, some type of nerve block to not need narcotics nearly as much. Try to use those as minimally as possible. That'd be a good discussion with the surgeon. Really aggressive physical therapy, getting active as soon as possible. Not sure about the post-concussion syndrome and where that fits in as far as a knee replacement. I may be missing that completely, so I apologize. All right, Mossy87, had pain constantly in my leg between my hip and knee for the past 10 years. Pain's very agonizing, always hot, cold sensation, numbness with the pain. Yeah, that's an unusual location for pain. I don't know if that's in the bone in the femur between the hip and the knee, or if that's a radiating pain from the lower back. That's kind of what the first thing, again, without being involved, what that would say. Doctors don't know what it is. Have pain in the hip, osteoarthritis in the back. Yeah, I mean, without examining you, I don't know. Those would be my thoughts. Either something in the thigh, femur area, or is it a radiating pain from the back? And the history of arthritis in the back makes you think some sort of radicular pain, radiculopathy, where the nerve, one of the nerves coming out of the spine, is getting compressed. Spinal stenosis, like a neuroforaminal stenosis, that's causing that, is my first thought. Merrick, is that, I said that right? Hey, AC joint resected, feel like scar tissue's a little loose. Yeah, that surgery typically works well. It's for AC joint arthritis or distal clavicle osteolysis, the end of the collarbone, tip of the shoulder blade at that AC joint, sort of right there. And you basically go in either arthroscopically or a small open incision and just cut off the end of the collarbone, usually about 1 centimeter. And that surgery does well. It takes obviously time to recover like any surgery, but it can have a good outcome. Physical therapy, using it as much as possible, but there's typically not a lot of long-term effects with that. Now, if too much is resected, you can end up with some instability at the AC joint and the distal clavicle, so that is another thought there. Desmond says, thanks, you are very welcome, and yes, I very much appreciate that. All right, well, great. Good set of questions. Let me see, somebody, I think I heard one more. All right, Liz says, some providers think I guess that's total knee replacement surgery, meds, and anesthesia could worsen cognitive abilities. Gotcha. Okay. I don't know any effects. I can't speak to the post-concussion. Again, and I am not, this is not medical advice, I would say that total knee replacements, are done, millions are done every year across the world. Hundreds of thousands in the United States with the medications during and after surgery, with the anesthesia during and after surgery, with the medical risks of surgery. They've been done long enough that if there was a true association to worsen cognitive ability, that would have been seen in the literature by now. It's not to say it couldn't happen, but it's certainly not a normal phenomenon. Now, most orthopedic surgeons have you go through see a medical doctor and basically get medically cleared for surgery to make sure there's not some underlying medical issue that could develop and become a complication after surgery. And so something that could increase the risk of brain issues, strokes, that types of thing would be potentially something that they might check out. But I think it's been done long enough that would not be one of my big concerns. I have lots of concerns with knee replacements, but the issues in terms of worsened cognitive ability after surgery would probably not being one of them. And News said, thanks, keep these live posts going, and I plan to. And I also will probably, at least for the near future, stick with these Monday afternoons as a change of pace from Fridays at noon. That is the plan right now, so I very much appreciate that. Great questions this month. I will be back next month, Monday, April 7th. Mark your calendars, or in the event in my YouTube channel, you can go ahead and click the bell to be notified, and I will look forward to seeing you then. You have a fantastic rest of your day. Take care.